Singapore stepping up care for digestive diseases with the new National University Centre for Digestive Health at NUH launched on the 16th of January. The centre aims to speed up treatment and reduce repeat hospital visits. And joining us to explain how this works, the centre's director, Adjunct Associate Professor Guan Huei, and NUCD patient Anson Hoo, who lives with a rare liver condition. All right, Dr. Lee, Professor, let's start with you first. Digestive issues may not get as much attention as they deserve, but Singapore does need a centre dedicated to just digestive health.
Yes, indeed, Singapore is actually seeing a rising burden of digestive and liver diseases. This is as a result of the function of us having an aging population and the modern lifestyle that we are living. Including the diets, our obesity problem, and some of the bad habits that people are adopting. So as a result, we were expecting that both the burden of the condition is increasing and the complexity of the problem is increasing as well. And very often these patients will require multiple specialist care. And the new centre actually aims to improve the coordination between all and streamline all the services in one integrated service, such that the care can be more efficiently delivered.
All right, and Mr. Anson Hoo, he would in fact exemplify the need for care that you have just described, because you have a rare liver condition, but that's just part of other problems you also have. And in a centre like yours, you can manage these various needs essentially under one roof.
Yes, that's correct. A lot of things, very often we may be seeing a single specialist, but they are often appears very fragmented when it comes to the care. In the context of Mr. Hu, he requires input from both the intestinal specialists in the complex problem of inflammatory bowel disease, as well as a liver specialist. And
I'll let Mr. Hu explain now these
yes,
two things, these difficult problems in their own right, but related, and I suppose each having a detrimental effect on each other. Mr. Hu, your problem, you've had the first symptoms in 2019.
Yes.
Explain where we are on your treatment right now.
So currently for my treatment on inflammatory bowel disease, right, it's been quite stable with the care I've been given by the gastro team at NUH. As of now, the issue comes down to my liver, which is the primary sclerosing cholangitis. This in fact is a liver injury with no known cure. So currently I'm in a treatment plan for a transplant to be done.
That model you have in front of you, Professor, could you explain Mr. Hu's condition with reference to that model?
Okay. At the core of Mr. Hu's problem is a body that has an overreactive immune system that is attacking different sites. When it's attacking the bowels, it can cause diffuse ulceration within the large intestines. That is what he's mentioning about inflammatory ulcerative colitis. At the same time, this same activity can occur in a related condition which attacks the bile ducts. Bile ducts are basically these green segments of within the liver where the liver actually drains all the bile into the intestines. And when they become inflamed and eventually scarred and strictured, these bowels don't flow, and the liver will slowly becomes damaged and fail.
All right, as Mr. Hu mentioned, where you are now with your condition, there is no known cure. In that circumstance, managing the issue, managing the problem becomes even more imperative. So this one-stop centre, of which you are director, explain how that one-stop centre manages a problem like Mr. Hu's, the different aspects of it.
Right. Okay, so in a condition that requires many different specialist input, so in this case, he needs a gastroenterologist, a liver specialist, liver surgeons, dietitians, care coordinators, even social workers. The activity actually begins from the moment they are referred to us. We carry out the triaging even before they come to see us, decide what form of treatment they need, such that when they arrive, we try to gather all the specialist care needs that he does and book all the appointments at the same time. And so in as many of the tests and appointments can be done at the same circumstance. Also, there may be a lot of discussions needed by the specialists, which also carry at the background, including the pathologists, the radiologists, to derive at a more systematic and organized plan for him.
And that you will need because, Mr. Hoo, your treatment is now largely home-based, so they coordinate what you need so that you can carry that out at home. Very quickly summarize what your life is like now with this ongoing condition.
So in the beginning, it was actually quite shocking, because it's a very sudden news I had after I got diagnosed. So the effect that I had from the ulcerative colitis was quite large, that I lost a significant amount of weight, and a lot of the energy was lost from the
How old are you?
I'm 25 this year, So I'm still studying currently. So the treatment plans, being able to take it at home, reduces the amount of time I would need to take in ward to do my work, and which might not be a conducive environment for me as well, especially when I need to carry my school materials down to the hospital, or I may need extra time to work on my assignments. So having the said issue at hand, the home-based care allows me to efficiently work on my assignments or even my schoolwork without the disruption that would take to wait for a bit, or even like around the ward itself.
All right, you spent a great deal of a young life actually being sick because your first symptoms 2019. A final question for Professor Lee. So this center launched on the 16th of January. That's correct, yes?
Yes.
So Mr. Hoo's management, patients like him, you will build on your experience in managing and better managing patients like Mr. Hoo. Larger goals for your center beyond this?
Yes. So NUCD is actually designed as NUH's cluster level asset with NUH at the center, where we coordinate the care at various levels. So we are hopefully able to translate the success we have within the tertiary center, academic hub, to the entire cluster. And so, for example, what he's going through having home care requires a lot of coordination between the hospital team and the home care team. And we hope to expand those services throughout as a model to first begin in the western part of Singapore and hopefully extend beyond.
Well, thanks, gentlemen, both of you coming in. Centre's Director, Adjunct Associate Professor Guan Huei, and Mr. Anson Hoo, despite your illness, taking the time and trouble and energy to come and speak to us. Thank you.
Thank you.